Hello, and welcome to the Voyage Clinics podcast. I'm your host, Dr. Shaunna Sanders. With me are two of my favorite guests in the whole world. This is my favorite guest in the whole world, Shaunna Sanders. She's my wife, and I'll introduce more about her in a minute. And then Mark Mozzie is here as well. Mark has a PhD in marriage and family therapy from BYU. He did his undergrad in Gonzaga, and he's from Washington State. He's a good guy. Shaunna, my wife, is extremely talented, way smarter than I am. And she did an undergrad in English. She did a master's in English, and then most recently finished a JD MBA as well. Very talented. Minors, I always mess this up, but I think French, math, and piano. Is that accurate?
Close.
Close enough. So she's like a voracious academic and very smart. Today, guys, we're going to just talk about a few different things. And really, this is the Inception podcast, and I'm pretty excited about it. I've been working on a podcast for a long time. We've been brainstorming. All of us have brainstormed about it together and in separate. And today, we're just going to talk really about the Voyage Clinics, the journey disrupting healthcare. We're going to talk a bit about the pain points of the current healthcare system and ways that it's broken, things that we've worked really hard to do to try to fix that. And then we're also going to get into the importance of connecting and intentionally connecting. Mark, PhD, marriage family therapy, Dr. Mark, he's awesome. And so he's going to help us out with some of the connection and some of those spaces of really importance of mental health and wellness. And looking forward to having you in many, many podcasts going forward. But today we're going to talk about some of those spaces, sharing stories, the power of storytelling. Shaunna, with her background in English and things like that, is a master storyteller. She's a great poet as well. So yeah, we're just going to dive right in. Why don't we just kind of like talk a little bit about some of the pain points of the current healthcare system? So I'd like to hear from both Mark and Shaunna as consumers of the healthcare system. What are some of the pain points that you guys have noticed? Mark.
Yeah, I mean, I think one that probably anybody can relate to that's been to a doctor recently and kind of the cattle herding experience where you're just kind of rushed in and rushed out and you're not really sure if there was a full assessment, if you got to ask enough questions. And then one recent experience I had, I even called ahead and asked, for some pricing breakdowns. And then the bill that I received was quite a bit different than that. Mm-hmm. And I thought, man, I even did my homework. Mm-hmm. So there's kind of that big, mysterious, what's it going to cost anymore, mm-hmm. for the big system out there. I think there's some really good doctors in that system that would like to do it differently, but they also get some pressure, to hurry things along. And so that's kind of, I think in a very, like in a nutshell, that's kind of a common experience it has been for me.
You said two things that are really important. One of them, I liked what you very first said. You were like, I'm not sure if I'm being heard or if I'm really, if I'm really getting the treatment that I need. That sense of, I don't know, I guess it's distrust. It creates distrust. And what do you think it is about the healthcare systems treating people like numbers, like cattle, like throughput? What is that? What does that do for somebody?
Well, I'll do a little compare and contrast, and maybe I'm jumping us ahead just a little bit here. But the first time I came to see you as a patient, I didn't know you super well at that point. And I remember you asked me why I was there, and then you ask additional questions. You're like, well, when's the last time you really had, a good checkup? Somebody really looked you over. And next thing I know, you're looking at my scalp and you're checking, because I was there for a mole. My wife had noticed a mole, and so she wanted me to have it looked at. And then you ended up removing the mole that day. And I've always said, there's no way to say I love you like leaving a little piece of yourself behind. But I felt like, and I think it was like an hour that you spent with
mm-hmm.
me.
Mm-hmm.
And I remember thinking, like, who does this? Like, this is just not common, but to me, it felt very reassuring. Like if there was something even I didn't know about, I felt like you were going to find it. Mm-hmm. And I thought, I'm in pretty good hands here. Like this is uncommon, but it's right. Like it feels good.
That's really cool. That feeling of rightness. I think that time with people create trust. And it's not just about degrees. I think we've gotten so sciencey with healthcare that we're very yeah, we've just gotten away from the importance of spending time with people and listening and hearing and creating that trust. That trust is actually very powerful. The power of trust. Um, we talk in science about placebo and the power of placebo and stuff. And placebo is fascinating. If someone believes that they're getting treatment for a thing, it's effective like 30% of the time. And I think that we're killing that magic a little bit by destroying trust and not, we're just not paying as much license to that as it needs to have, that time with person and listening and hearing them, listening to their story, getting to know them. And it's really powerful. The other thing that you mentioned was there are a lot of docs stuck on this system that are really great people and wonderful humans, and they're just stuck in a system that's very dogmatic and very I don't know, it's very left brain driven, right? It's like it's throughput and it's hustle and it's diagnose, treat, prescribe next, right? And so we've kind of gotten away from the art of caring for people, like the old school vintage healthcare, like the way it used to be, which is more relationship driven and just spend more time. And it's hard. There's a lot of constraints on that system that push it in that direction, and I understand that. But that's one of the reasons why we created the Voyage Clinics, was to buck that system and try something different. I want to hear from Shaunna a little bit. What are your experiences with the pain points of healthcare, and what have you seen?
Sure. So my pain points, I think, focus on my role as a mom of 4 kids. And the huge challenge is trying to figure out what that health insurance that, gets deducted from paychecks every 2 weeks, what it'll actually pay and what it won't pay. And, what's the billing, and it's frustrating, and it makes me not want to go see a doctor or interact with the healthcare system, because I like to know what's going on, and I never know what's going on, what's going to be paid for. I can tell you a story about this experience with insurance and the healthcare system. So between our 3rd and 4th children, I had a miscarriage, and I was pretty far along, like 11 weeks. So I lost a lot of blood. So I went into the hospital and had a DNC, which is just a procedure where they help clean out the uterus so that you don't keep bleeding all the time. And I got home from that, and I was still really tired because of the iron deficiency and stuff. And then a few weeks later, I got the bill from, I think it was, I don't remember, it was my insurance company or the doctor, but they had miscoded it as an abortion. So they weren't going to pay anything for this procedure.
And this is partially because I trained at a Catholic hospital and they had certain rules.
Yeah,
they miscoded it.
They miscoded it. And I was so upset. And I ended up calling the doctor who did the procedure, and he called the billing department and straightened it out. But it was really frustrating that experience ended the way it did, because it was a traumatic experience from the very beginning, like walking into the hospital.
Yeah.
And then when they sent me this bill and said, you have to pay for all of this because you did this on purpose. And I was really, really upset. And I feel like trying to talk to someone who is behind your insurance company is crazy. It's even harder than talking to a doctor. You can call and try and talk to a doctor, but you have better luck getting in touch with your provider than you do with somebody that is, providing health insurance for you. So I don't really like to interact with the healthcare system through my insurance card. It's inefficient. It's confusing. It's annoying. And so often I just say, well, I guess I'll just figure it out, because it's easier to do that than to try and figure out how much it's going to cost and what the copay is and where I can go and who's a network and who's not a network. And I'm a pretty intelligent person, but I still have a hard time navigating insurance.
Yeah, that I think speaks volumes. I mean, somebody as sophisticated as you, they hand you here's your insurance plan, and you're still like, having a hard time
Yeah.
sifting through all of it. And
Yeah.
you're a lawyer, you have an MBA, you have an English
Who
master's,
has time to
you're a
read
speed
that?
reader, and you
Yeah.
have 4 kids. You're basically superhuman, and you're still struggling with this monster system. And that's a big piece of it. The insurance companies, they don't serve their client. They don't serve the people that they don't serve. They really serve their shareholders. That's their gig. And it's a bummer. It's kind of a bummer. I think they're kind of malaligned with the
Sure.
end user, which is you, right? And
Yep.
there's no heart or soul in someone who just had a miscarriage, hormonally, emotional, all the things that come with that. And no, here's a bill you're going to have to pay for this. And I mean, that was a hard time. I remember,
That was
even
tough.
though I was absentee father in residency, that was still really hard. Well, that's really good. Those are a lot of the pain points, and I saw them. So I'm a rural family physician. I was, delivering babies and working in the ER, the hospital. I'm from a small town in Nevada, and I guess I got a lot of sagebrush cowboy in me, I guess they call it. And we're used to kind of bucking systems, right? And we just that's kind of how I was raised, and so I've been in the system for more than a decade, and I've seen all these pain points. And I went into healthcare again. I was like 5 hours from the nearest hospital. I was very remote, very rural, and I just love people. I just like talking with them and caring for them and listening to them, and so that's really why most family doctors that I know went into healthcare because they like caring for people. And when they're plugged into a system that really doesn't, it really constrains you in certain ways that really make it hard to do that. It makes it very hard. Doc, you only have 7 minutes left with this client, and I haven't even started seeing them yet.
Yeah.
I'm like, what do you mean?
Do you remember the first time you kind of went, wait a minute, this isn't how I'm built?
It occurred over time. So in med school, you're just so, bright-eyed and bushy-tailed, and like, oh, it's going to be like this. And then as you go out into your 3rd and 4th year of med school, and you're out doing rotations with all these docs, and you're like, oh, it's not like that as much. And then as you go into residency, and you're like, whoa, it's really not like that. It's whoa. And so then you're just kind of you become a little bit jaded, a little bit disenchanted, and then it's hard. It's a hard evolution of a lot of your altruism gets beaten down and crushed down a little bit. And so yeah, I was in that system, and I was in a rural town. I was actually in Moab, Utah. Love that place. Delivering babies, doing all the things. And I noticed that my patients just didn't come in as much. They got pushed away from me by the very insurance that they were supposed to be able to see me with. But because of copays, confusion, cost,
Some of that stuff you were talking about, Shaunna.
they just stopped coming in as much. And so it created barriers to their care, where I saw people getting sicker and sicker because they were scared to use their insurance to come see me, and they were in their basements Googling stuff, thinking they were okay or not okay, and stressed, and cortisol levels are really high. And it's a very scary thing to be a mom, to not know what's going on, or a dad, and to not have an access point where they can just ping their doctor with some questions.
Yeah. That brings up another pain point that's related. I think that sometimes it's super frustrating if you need to get in to see your doctor and you call to try and schedule, and they're like, well, he's scheduled 3 weeks out. So, you can come in like Tuesday, the 5th Tuesday of the month in February or whatever. That is a huge pain point. So you're like, well, I might as well just not make the appointment, because I can't wait 3 weeks to get in to see my doctor about this.
Yeah. And you certainly can't just text them.
No.
Or just call them.
No.
or sometimes you get told, well, then you'll just have to go to the ER.
Right.
Yeah.
Wait, what?
Yeah.
That's a solution? That's the only other option here, is just to hobble into the ER and say, what?
I have a cold.
Yeah.
Can you give me some? Yeah.
So these pain points, I mean, what's the sequela, or what's the result of all these pain points? I mean, what are we creating in America in healthcare by having all these pain points?
The best healthcare system in the world that nobody uses.
Yeah. That's a good slogan. That's a good slogan. No, that's so true. That's so true. We're pushing people away from actual care. What else? I think this, like what Mark said, like pushing people to the ER. Oh, can't see you. You're gonna have to go to the ER. And it just pushes the cost of healthcare up so high. Like I think they did research on like we're one of the most, we spend the most money on healthcare in the United States. It's fascinating.
Yeah.
And I think the other research, I forget who did this. It was oh, shoot, I don't want to misquote, so I'm not going to say it, but there was a study that I saw that of healthcare dollars spent in America, 6% goes to the physicians.
Oh,
The providers.
And then 7% goes to nurses. And then everything else goes to whoever else gets paid into the system.
Cost plus.
Yeah.
I was just talking with an orthopedic surgeon the end of last week, and kind of I don't know what just a little bit of disappointment and embarrassment. And he was basically saying, I don't make much.
Mm-hmm.
He said, the days of surgeons being, stuffing cash in their pillowcase at the end of the day, it's just, those days are over. And he kind of went through some of the numbers, and he talked about his surgeries, and it was shocking to me that, it used to be that somebody that was so highly specialized had a little more leeway, but he had the same frustrations.
Mm-hmm.
He only had so much time to do ABC. And if there were any complications or challenges, then, that was a big deal. And to some degree, I think he felt like his hands were tied as an orthopedic surgeon.
Yeah.
So what's the takeaway? Something's got to change.
Yeah. So how do we buck the system? So we were in Moab. Shaunna decided one day, I think I'd like to go to law school. So
it wasn't just one day I woke up and said I want to go to law school. It was the
Are you sure?
culmination
'Cause I thought that's how
of
it
a
happens.
number of discussions and a lot of thought. And then we both decided this is a good thing that we should pursue.
Okay, thanks for clarifying.
Yeah.
We decided to go to law school together. And so we moved. We moved from my dream job in a rural setting, delivering babies, doing all the things. I was doing hospice care. I was doing ER care, hospital care, clinic. I was like sideline doc at the football. It was dreamy, but it was a lot of stress and a lot of work. And so, Shaunna was ready for a change. And I said, cool, because you supported me all these years with my educational pursuits. Happy to do that for you. This is really important. And so we did, actually, and it was lovely. And I would make it sound like it was kind of a benefit, but it was actually great. So I took a job with a corporate, physician-owned corporate, local, big conglomerate of physicians, and I'd never worked in anything like that before. And I just I thought, well, maybe this is okay. And so, I quit after 2 months. It was the same gig. It was just the corporatization of medicine incarnate times 20. It was just brutal. And so they were all about throughput. They wanted me to see 40 patients plus a day, and I'm like, that's unreasonable as a family doctor. It's just silly. And a lot of those docs are doing that. They're just cranking, right? And
do you kind of remember that decision, that moment of decision where you were like, this ain't how it should be done?
Yeah, I mean, I think I have too much cowboy in me, because I was ready. But it was scary. It was really scary, because I've got 4 kids. I got a wife in law school, and I just rented a home, and and now I'm giving 2 birds to these folks, and I've got no income.
And by bird, you mean like parakeet?
Yeah, I'm giving them a couple
cockatoo,
parakeets.
yeah.
Yeah. And so I'm stepping away from this, and I'm just jumping off a cliff, and I'm just saying, I believe in really good care, right? I'm just buck the system. And is there something else that we can do that's better? And
can we just pause a minute on that decision to jump? Because I think that sometimes, and I'm guilty of this as much as you are, but sometimes we gloss over that like, oh, we just jumped off a cliff and we had parachutes and everything was fine. But I don't think it's really very clear exactly what that jump looked like, because a family physician or any other physician, if that person wants to open a private practice, traditionally, they get credentialed with a number of insurance companies, and then those insurance companies send patients to that physician because they're credentialed, they're in network. So you have a built-in marketing strategy for traditional physicians that go through private practice. But But John came to me and said, I don't want to do traditional. I want private practice, but I don't want to I'm not going to bill insurance. I'm not going to,
That's what
you
you were
know,
getting away from.
yeah.
I don't
That's what
want
he was,
to be
yeah.
constrained by the
Right,
system of
right.
inefficiency that creates
Right.
5-minute visits.
What
and-
that means is we start at 0, like no patients at all. So it's not like we had to wait a couple months for accounts receivable to come in, and then the patients that the insurance company sent to you, we would then see the money and we'd be okay. We could just hold our breath for a couple of months. We'll be fine. We have savings.
Mm-mm.
It was like
No safety net.
Burn the ships.
no safety net. Yeah.
And pioneering a
Mhm.
total different delivery model in a community where we didn't know anybody. We literally just moved here. And
Yep.
it was scary. What
It
were we
was-
thinking?
I don't know.
How was that for you?
I think I was sleep deprived because I was in law school.
Yeah.
And so my first semester of law school, we had a nanny because we had 4 kids, their ages were like 8 to 14.
Detail schmetail. I
Yeah.
still don't know my kid's age.
Yeah. They were in junior high and elementary school. And so I had a nanny to help out with that. So I would go to law school in the morning, and then I would stay and study until like 5 o'clock, and I would come home and the nanny would make the meal that I had planned ahead.
So I had
You
you
know, and
distracted
provided.
properly from
Yes.
this decision.
And then she'd take care of the kids until I got home. She'd eat dinner with us and then she'd go home. And it was great. I felt like I had time to study, and I didn't have to then I still had time to read bedtime stories to the kids, right?
Yeah.
But then when you said, let's just do this with no income, I was like, well, we got to get rid of the nanny. We have to let the people that come and clean the house every other week go. Like, I'm going to have to do it all myself because we can't afford to hire anybody else to do it. Yeah, it was awful.
Yeah.
But why? I mean, there's this lingering question, right? Like, why would you do that?
Yeah.
I mean, short of just being like loving risk or something.
Yeah. In my heart of hearts, I believe that families deserve good health care, and I want to deliver that to people. And I felt like I was not resonating with my core values of caring for people in a good way.
Hmm.
And
So no
I'm
more compromise.
I'm uncomfortable enough, and I've got enough sagebrush cowboy in me to just buck the system. And it was definitely hard. I remember, Shaunna and I are spiritual folks, and making it a matter of prayer, and it was difficult. There were pain points for sure. There were times when I was just crying, like, I don't have anybody to care for. I don't have any income for my family. Like, I'm a host. It was hard. It was really hard.
Mhm.
But I remember we just felt a sense of peace in our hearts, and we knew that we were just being true to ourselves and true to what we believe in. And and we just did it. And here we are, 6 years later, and
Yeah.
I don't know. We're not wildly successful, but we're reasonably
working.
successful.
Would this be a
And
good
we're-
place to talk about like direct primary care?
Yeah.
And like
The
what
model.
that even is? Yeah. Because I'm imagining if somebody's listening, it's like, okay, so what did you jump to then?
Mhm. Yeah. So, what did we buck? We bucked the system, which we talked about all the pain points. And what did we buck into? Like, what did we take on? Like, what do we now saddle up with? I'm just on the cowboy kick today. I've got boots on too. I just can't see them right now. So we stepped into a different model for caring for people. And I have a couple of friends nationally that were doing this kind of model. It's called direct primary care. And it's where you just pay a monthly membership or an annual membership, and then you get reasonable access to your providers and your docs and stuff and your team. And so I did it. I just said, okay, let's do that. See how it goes. But again, in my community, there was 0 people doing that. And nobody knew me. I didn't know anybody. I didn't have a following, I didn't have a whole bunch of clients that they could just kind of talk to me.
Mm-hmm.
But it's beautiful. It allowed me opportunity to spend more time with people and to hear their stories, to listen to them. One of my favorite things to say as I enter a room, somebody's, hey, how you doing? Tell me a story. And I listen to their story and I ask a bunch more questions, and we can get past the surface level care that the current system provides and just dig a little deeper and do a little bit more things for folks and provide a little different care than the current system does. And it's really rewarding. It's just really, really satisfying. And one client, turned into 2, turned into 5, turned into 10. And then I've had, a little town that I get, a small town of people to take care of. And it's been really, really satisfying. Yeah. It's really
Yeah.
So I'm thinking about something.
Okay.
You're watching this happen, right? This
Yeah.
guy you love that you can tell doesn't, that is kind of burdened in the system we've talked about. What's it been like to watch him be able to, be the kind of doc that he wants to be?
It's been amazing. And I don't want to say life changing. I want to say like marriage changing or family changing. Because when we lived in Moab and he was in his dream job and he was, doing inpatient care and a busy clinic, etc., the kids and I would just do all the fun stuff in Moab by ourselves. He didn't usually get to come because he was on call or he had to see a patient. Like the only time he took vacation is when we went out of town. So even though we lived in Moab, we did, hiking to see Delicate Arch and we floated the river and we went up into the LaSalle's and John went to work.
And for those that don't know, Moab, at least in Utah, it's like a recreation destination. Like you go to Moab to have fun.
Right.
So you're living there.
So we're living in Moab.
But you're having fun alone because...
Yeah. I mean, I'm having fun with the kids, but they not with John. And I saw it kind of take its toll on his cheery disposition sometimes. He wasn't as patient. He was a little bit more short-tempered with everyone. Just because I think he was tired of having to see so many people and having to work under the constraints of that system. So, of course, when we first started Voyage, it was challenging, but we celebrated like every family that joined. We'd be like, got a new family today, and we'd like have a party. It was so fun. I was excited to watch the numbers grow. But he just kind of came back out of his shell. Into that cheerful, friendly, listening doctor that I always knew he was, that had just been a little bit crushed down by the system.
Your care batteries are just kind of running on empty. And because you're in such a brutal system, it's tough. Yeah. It's tough from an administrative standpoint, as a physician, and then from the constraints that it puts on you and that you see that it puts on your patients and on your clients. It's soul crushing. I developed a severe allergy to administrators. I would actually break out in hives and stuff. It was brutal.
And you can't say that because I am an administrator
Shaunna
in your
now,
clinic.
I don't have an allergy to her though. I have healed.
Oh, good.
No, this process has been evolving, and it's been, I call it like the evolution or metamorphosis of a physician as they step off of that broken system that's demoralizing, fatiguing, and battery draining onto something different. And it was good for me to reset. It was good for me to just have a duration of like, oh, you don't have anybody to care for a while, and you got to recalibrate your care and what that feels and looks like. And so it was really good for me. I became better at connecting with my family, better at connecting with my spouse. I got rid of sarcasm. That took a while. That was a thing I had to recognize that I was overdoing. I think it was a coping mechanism because I was like, I don't have anything left. Here's some sarcasm to just get me through this conversation, right? It was kind of lame. And I was like, oh, I got to fix that. So I did. And, I have a few scarred teenagers from that, but not too bad. There goes the sarcasm again. But there, it was, it was soul changing and really good for me, and still is good for me as I can really connect and really create relationship. And I guess we call it love. I don't guess we talk about love in medicine, but there is, and I love my people, and I care for them like family, and they know me, I know them, I know their dogs' names. Like, we're good friends. And
I think it's important to note that that's not just an accident, like what I'm hearing in this story, and some of this I'm hearing for the first time. this is a very deliberate thing. And so when somebody comes, I mean, maybe I could share a story,
Please.
right? So I got COVID
Mhm.
and I got it pretty bad. You know, a lot of people can relate. And I remember calling and I was reluctant to call you because I'm like, do I call like my doctor's, direct line, and you picked up and you're like, hey, I'll be right over. And I'm like, what do you mean you'll be right over? Like, I thought I was going to have to find a way to be drugged to the car and drugged behind the car, to some office to be seen. You come to my house. You came to my house. I'm laying on the couch, sicker than I've ever been. And you brought me a slingshot to look at that you had just carved. And something you may not know about Dr. John is he loves fine wood.
Fine wood.
You have a piece in your hand there, and he'll carve these cool things. And you had just either carved or made or something this slingshot, and you were showing it to me, and I'm like, I really want to be interested, but I'm kind of dying right now. But I thought, this is like the true kind of family doc, country doc, like picture that at least I'm imagining healthcare used to be.
Mm-hmm.
But literally, I'm on my couch, very sick, and you show up, check me over, do the test, yeah, give me the stuff I need, and then you were gone.
That's pretty cool, Martin. Thanks for sharing that. I think deliberate, intentional connections are missing from our healthcare system. And it's part of the secret sauce to this movement of largely family physicians and other primary care specialists moving into the direct primary care space. And ours is the Voyage Clinics, but there's a lot of them nationally, and the growth is really tremendous. And it's really beautiful to see so many doctors moving in this way of caring for people. Mm-hmm. Deliberate, intentional connections, I think, are super important to me as a physician, as a human, as a husband, as a father. Super important to connecting with my teenagers, to my family, and to my clients. And I want to speak just briefly, if we can segue into deliberate, intentional connections and maybe just like stories and mm-hmm. making those connections and the importance of those connections and hearing stories and what that does for our lives.
I like that. I kind of have a question,
mm-hmm.
right? And I'm thinking, what difference does it make?
Mm-hmm.
Right? Like what does it matter if my doctor hears a story from me? Mm-hmm. I mean, I'm just there to get my temperature taken anyway.
Yeah.
Right?
Yeah.
So is that an okay question at this point?
That's great.
I think it kind of fits. Like, what difference does it make for that connection and that deliberate, intentional relationship building stuff that you've embraced?
I'm going to deflect this question to Shaunna because she's a master at stories and what stories do. And I'm just going to deflect that to her.
I think it makes all the difference in the world. And I'm going to come at this from an English perspective because I taught English for a number of years before John went to medical school, and during, actually.
I'm a science guy, but liberal arts are good too.
That's right. Liberal arts are good. So there was a mythologist, Joseph Campbell. Have you ever heard of Joseph Campbell?
Not till today.
He studied the mythologies of all cultures of the world. He wrote some really, groundbreaking books if you're in that field, mm-hmm. in that area. And the one that he wrote one called The Hero with a Thousand Faces. And he talks about the journey that the hero goes through in all of these myths, which are stories, right? They're stories of the hero gets a call to go on a quest, a call to adventure, right? Something happens that sparks him getting up and stepping out of his everyday mundane life. He meets a mentor who kind of helps him navigate these new challenges. Then he runs into obstacles and has to conquer them. He fulfills his quest. He returns home and he brings with him something of new life that he can infuse his community, his family with, right? So this is the hero's journey. But Joseph Campbell said, and I think all of us can recognize that we're all on our own hero's journey, whether it's on a macro view, our whole life, or little little experiences in our life that are kind of a hero's journey, where we're called to step outside ourselves and do something uncomfortable, and we've got obstacles confronting us. And the more we can recognize that journey that we're on in our lives, then the better we can overcome the obstacles and fulfill our quest. But one of the best ways to recognize that we're on that journey is to tell our story to someone else who can witness that, who can validate it, who can say, oh yeah, you're having a hard time right now, or you're in this spot, right? So stories are how we connect, because it's in our collective unconscious. It's part of who we are as humans. We're naturally geared toward being attracted to stories, telling stories, making stories out of our lives so that we can make sense of the things that happen that otherwise would just seem to be random thoughts of an uncaring universe. So
the telling of the
the
story
telling of the story,
and with somebody who actually cares.
yes, that's what helps you as a human get better or move through those phases in the hero's quest, so that you have something to bring back to your own life or your family or community that infuses it with new life. And our healthcare is one of those stories that we don't often tell, because we don't usually think of it as a story, but it is. And it is the story, right? It's life. So being able to tell a story to your doctor, then your doctor can help you fit in those pieces so that you can fulfill your quest. And that sounds a little hokey, I guess, because I'm an English major, but it's true. It resonates on a much deeper level.
Two things. Two things. Yeah. A, you're so hot when you wax eloquent and be so nerdy like that. I just have a huge crush on you right now.
Okay.
And then two, you have described beautifully the art of medicine, the art of true healing, right? And these heroes that come to me and bring their stories and bring their sick kids or their sick selves, and they tell it to me and I hear it and I help along that journey. I'm just Gandalf. I don't know. I'm a wizard.
You're the mentor. You can be the mentor. And I'm not going to say that you're, Gandalf or Dumbledore, but every person needs a mentor. And in that context, you can be that mentor. You don't overcome the obstacles for that person. You don't fulfill their quest. You just guide and direct them and help them with the knowledge you have and the experience you have to fulfill their own hero's journey.
I have goosebumps right now, I'll be honest.
Oh,
you've laid it out beautifully, and we didn't plan that. That was lovely. Thank you for that.
You're welcome.
That's a beautiful analogy and something very powerful. Wow, I'm still so hot right now. I gotta look away. Mark, can you speak to this from your expertise, like what the power of connection, deliberate intentional connections has for individuals, for families, for people, for relationships, and maybe like we don't have much time left, but let's talk a little bit about how can we be better at that?
A couple things. So in my first master's program, I had a really good professor, Paul Hastings. Paul, if you're out there,
let's go, Paul.
Good guy, and just so much respect for him. And he talked about the gift of being known. And I didn't fully appreciate it the first time I heard it. I'm like, oh yeah, I get that. And now I've realized I didn't fully appreciate what he meant then. But the gift of being known is super powerful in relationships. Sometimes I talk about intimacy, which is, there's a lot of different forms of intimacy, right? Intellectual, emotional, spiritual, sexual, religious, or spirit, And so on the emotional intimacy level, it's like into me see. If I open up and let you see into me, and you treat that with kindness and you're careful with it, it increases our connection. Something else that came from that first master's program was a book called Escape from Babel. Fascinating book. And it's about, counseling, kind of a 20,000 foot view of counseling and effective outcomes. And in that book, they talk about how 70% of therapeutic outcome, and this is in a counseling setting, can be tied to the relationship. So if you come in and you're just a sterile, you know, robot, you're leaving out statistically, a huge portion of people's wellness. And now, medical treatment may or may not be counseling per se.
It's equally as collaborative. That same thing
Yeah.
happens 100%.
Yeah.
And for your intimacy part, that piece, when folks come to me, they tell me like very personal things.
Yeah.
And like there's this trust, there's this,
Mhm.
and I cherish each of those pearls that they share with me. And it is
That's
beautiful.
probably
to
why they
see-
tell you.
It's beautiful to see into that and to listen and hear it. And they know there's no judgment or anything like that from me. Just love and listen and hear it and be with them through that. I don't
Yeah.
always have answers. I mean, some of that stuff is way not even the experts of experts have answers to some of those things. And yet to help them along their story and their journey and just be there holding space and hearing and connecting
Mhm.
is powerful. It's powerful medicine.
Mm-hmm. Definitely. So I think in a nutshell, my answer to, what's the benefit of stories or people being able to share with you is it fosters trust.
Mhm.
It fosters a sense of safety. And I think more than anything, like being one of your patients, I would call you with any problem, you know, and I guess some people feel like, well, I've got to call my doctor, but it's always like, I don't really want to tell him I have a wart, on my back that needs to be removed. I'm like, hey, I got a wart, because I know you don't care. You care about me. You don't care about that.
Mhm.
And that's really evident. And I hope that's something that can kind of catch on,
Mhm.
that your leadership in that I'm sure there's some other docs out there that are having an experience like you are, but they're definitely not the majority right now.
Mhm. You're right.
And I hope that more of them can be like, oh yeah, I want to be the guy that people talk to. I want to care, or I do care. I want to be able to show that I care.
Is there a skill set, like maybe one or two pearls that you can share with us? Just something we can do better to have better connection, more deliberate, intentional relationships, to be better hearers of stories and holders of space. It sounds. I don't know.
Well,
that makes sense.
Yeah, take it from a hypocrite.
Okay.
I mean, I can tell you what I this is my own little version of hell, right? I know way more than I can do right, but when I've been able to do this, it's magic. And what it is sometimes if somebody starts to talk to me, I'll say, what do you need from me right now? Do you just need somebody to listen, or do you need like a solution? And you know what almost always people say?
Just listen.
I just want you to listen. I know you can't fix it. I can't fix it. I just want to tell somebody, right?
Yeah.
So it helps to know that from the onset or the outset of the
Mhm.
conversation.
Mhm.
And then just some genuine empathy,
Mhm.
Oh, your dog got hit. You're probably going to have to put it down. I'm so sorry. That,
Yeah.
I know that little guy was your best friend,
Yeah. That's cool.
and just kind of getting away from that feeling of like, if I listen to you, I'm going to have to now I have to do something to change. Like I can't, there's so many things in life you can't change. There's no fix for it,
Yeah.
but helping that other person not be alone, is a huge thing.
Shaunna is extremely talented in this space, and I just was wondering if you have any other pearls in the space of connection, friendship, stories, listening, hearing. I suck in this space. One time, Shaunna told me, "You suck at emotional validation," and I'm like, "I don't know what that is, and B, I'll go work on it. Let me try
Okay.
some."
I think that the key to being able to, one key that I've found to being able to build that connection and listen well, is to be able to turn off that judgment in your own brain, right? So that you're not analyzing what someone is saying, trying to weigh its merits, or anything to do with judging. Just listening, almost like a lawyer would, right? Because you're not the judge, you're the advocate. As a lawyer, I'm trained to be an advocate. So when I'm listening to someone's story, I'm not trying to decide who's right and who's wrong or what, mistakes they made or anything. I'm just listening so I can advocate. And so turning off that judge inside your head is a good way to listen effectively.
I would say from a physician standpoint, turning off the physician. The physician listens and sometimes tries to figure out the solution to the problem, right? And I had to work really hard at like, no, just emotionally validate, just listen and don't come up with the solution. And so that was a good learning point for me in the family, with a family space, being better at that.
Can we, as we get wrapped up, can we go back to when we very first started, the beginning of this podcast, we talked about the pain points of the healthcare system.
Sure.
And we talked about Voyage Clinics, but we haven't drawn it all together and tied it up with a bow. How does Voyage help fix those pain points, and what does connection have to do with Voyage and the pain points?
Yeah. I think the Voyage Clinics are our core value, our whole mission. And we say this every week. We have a staff meeting and we say, what's our mission? And we all talk about it. And our mission is to provide beautiful, affordable healthcare to our community. And that's really why I started this. And so we give people easy access to their doctor. We do house calls. We do telehealth and video chat with their doc and their team. We allow for easy same day, next day appointments, 30 to 60 minute visits. We're just like delivering something different, right? Something that insurance card does not deliver. The insurance card is really important to have for coverage for various catastrophe things and whatnots. But say majority of our clients, we relieve enough of the pain points for them that they have insurance and they still come to us and they still find value in what we bring to their healthcare equation. And I'm just we as a team are consistently trying to find the best care, the most affordable, transparent ways of navigating that care. And we're trying to deliver that care. And it's an ongoing, beautiful, evolving process I think we just keep working at it.
Okay.
And I got to ask a question that I think people are, I'm not trying to make this an infomercial, but so clearly this costs thousands of dollars every month, right? Because to pay for that level of care, it's got to be expensive, right?
Yeah. Part of the mission of the direct primary care movement is to keep everything affordable and really beautiful. And so we're kind of bucking that system too. So I don't make millions of dollars. It's not my objective to do that. There are people that do what I do that charge 5-10 times what I charge. And so, no, it's not. Most families, we come way under what their one person deductible is for the whole family, for the whole year's worth of care. And there's no copays, no deductibles. You can utilize us as much as or as little as you want. And I just like it that we're re-scripting. We're giving people an abundance mindset around their care instead of a scarcity mindset. When you had COVID and you were hesitant to reach out to me, you have been conditioned to be that way.
Mm-hmm.
And I want to recondition my people to have an abundance. Well, I think I'm going to text Dr. Sanders.
Just be like, I'm not feeling a lot of love today.
What's going on? So I want them to, reach out appropriately for various things and let's help them navigate that and hear their story and move forward in life. Yeah.
I think that's where the connection piece comes in, because that connection is the turning point to changing from a scarcity mindset around your healthcare to an abundance mindset.
Mm-hmm.
As you make a connection with your team, your healthcare team, and so then you're going to reach out and it's going to be abundant.
Beautiful.
Something that, again, I'm trying to avoid an infomercial feel here, but this was just my experience. Like, this is what happened. I needed an MRI and I needed an upper and a mid or something. So 2 different MRIs. Voyage had negotiated a discount with a local radiology place.
Yep.
You're like, hey, go here, cash pay, the first one was $250. The other one was $275 out of pocket, cash pay. I'm like, that's most people's deductibles higher than that. And I don't know across the board if everything's quite that good, but that was really cool to me because I'm thinking MRIs are like thousands normally.
Yeah.
And blood work, one of our daughters is getting some blood work done, and I think it was like $50 because you have negotiated with other providers so that, the affordability, I guess my point is that it has branched out even to other supporting services too.
Yes.
And I think that's like way cool.
Nobody's really advocating for the affordability of healthcare to the families that need it. And insurance companies are trying to, push cost onto the patients or clients. And I'm just trying to find them best prices on everything.
Oh.
And so even with their insurance, often the channels that we have negotiated are cheaper and better and more affordable. And so, that's part of our mission. And one of the things we'll talk about on the podcast is some of those transparency pieces. And I appreciate you bringing up those, the price points on some of those MRIs and things. And we just keep finding new and more affordable ways. Let capitalism work for you. Why not? Right.
Yeah.
And so I'm the advocate for my people to like, hey guys, there's another imaging company over here that offers it for this much. What can you do? So it's not that hard. You just got to let folks know that that's how you do it, And so, it's been fun. We probably save the average family more than they spend with us on an annual
By
basis.
far.
Even with insurance, it's
By
fascinating. It's fascinating.
Yeah.
And then they just receive a really great uptick on their overall health care coverage and healthcare access points and things like that as well. So there's other benefits. But it's all really fun.
Can I tell the end of this story?
Sure.
You didn't cut me off, by the way.
Okay.
It just occurred to me that, and I think people need to know this. So the result of that MRI for me was very scary for about 10 minutes because I got the results back, and I don't know if you remember this, but I got the results back, and there were some codes, and being a good layman, I got on Google to find out. I misunderstood one of the codes. I thought that it was indicating brain cancer. Do you remember this? Mm-hmm. And MRIs look kind of funny anyway, and it was at the side of my head. And I was like, I didn't know what to do with that, and like I said, for about 10 minutes, I was in that space, and it was not like I wasn't doing well with it. And I had reached out to you. You called me, right? Called me on the phone. 10 minutes is a pretty good response. It's like, hey, and I'm trying to keep it together. And it's like, can we look at the images? Because, can we walk through what the different codes mean? And then I was like, does this mean what I think it means? And you were like, no, actually, that doesn't mean that. Massive relief, and that was kind of a moment for me where I was like, I needed somebody, and I needed somebody that could look at that and give me a definitive answer. And, I don't know what the alternative would have been, call in and we'll see you in 3 weeks kind of thing. I don't know, but I'm like, I need to talk to somebody that can be the professional that I need right now, So that was a cool moment for me, and I really appreciated that.
That's so cool. Mark, thank you so much for sharing those stories. And Shaunna, thank you so much. I've learned a ton today, and I really appreciate this. Is a really great Inception podcast, not Conception podcasts, unfortunately. but it's been really great, and I'm really, really bad humor. Sorry.
That's awesome.
But no, thank you all for participating, and I really look forward to the future of continuing to do these kinds of podcasts, and hopefully it brings some light and knowledge to our community, and we're going to just keep on moving forward and in the Voyage Clinic podcast. Yeah, it's going to be fun.
Let's go.
All right, let's go. Thanks, guys.